Welcome back. The next chapter we're going over is Chapter 13, Advanced Topics and Treatments. Our learning objectives for this chapter is to explain advanced skincare topics and treatments for licensed trained estheticians, describe chemical exfoliation and peels, identify how to safely and effectively use chemical exfoliation and peels, discuss the benefits of microdermabrasion by type of device, explain the benefits of laser technology, explain the benefits and types of light therapy, discuss microcurrent treatments, discuss ultrasound, discuss microneedling and nanoinfusion, describe spa body treatments, discuss common treatments used to address cellulite, explain the benefits of manual lymphatic drainage, and describe the field of medical aesthetics. So for advanced skincare topics and treatments, having an understanding of the foundations of the equipment that we would use, any indications, so any reason that we would want to use something on someone, and any contraindications, so any reason that we would not want to use something on someone, will help enable us to employ a combination of different therapies that will yield a better result for the client and their skin. So why should we study this? Well, having advanced machine technology, it is constantly being developed and improved on, and some of the technologies are just expansions from the original formats. So staying up to date with them will yield typically better results. Offering advanced treatments will also keep us more competitive in the marketplace, and the esthetician's professional expertise is in analyzing the skin and recommending the best program will help make the procedures safe and effective for our clients. In exfoliation, we have different kinds of methods that we can do on people. We have mechanical, manual, and chemical. Chemical exfoliation, the definition, is the process of removing excessive accumulations of dead skin cells from the corneum layers of the epidermis, so the outermost layer of the skin, and it can be referred to as superficial peeling, exfoliation, keratolysis, and desquamation. Typically, advanced training and certification is necessary for chemical exfoliation. Typically, they're going to yield more significant results and help produce a clinical change in the skin, and they're commonly used to address photoaging, acne, hyperpigmentation, and in addition to other conditions. A lot of chemical peels come in different formulations and strengths. So like our peels, we have the mandelic acid one, we have the lactic acid, and then we have the two different glycolic acids that come in different strengths. Those are all formulated a little bit differently, and then they also have the varying strengths. So that would be something that you would want to look at if you are looking for a product line, making sure that you as an esthetician, if you're going to be by yourself, you're only doing superficial peels. And you would determine the treatment protocol, which is going to vary depending on the product line, but it typically, most peels consist of applying the product, neutralizing it, and then also removing it. So that's not going to change a whole lot product line for product line, although they may have you use different neutralizing products, but typically they're all going to do the same thing. So this is kind of a recap of our chemistry chapter last semester, but going over acid, alkaline, and pH relationships. Remember that our acids are going to be a pH of 0 to 6. Neutral is a pH of 7. It's right in the middle of the pH scale. Alkalines are going to be a pH of 8 to 14. And then our skin is an average pH of 5. So around 4.5 to 5.5. So it's good to know that acids penetrate the skin and can be a cause of irritation. Acid has to have a pH lower than the skin's pH to be effective. However, a pH of less than 3 is not recommended for salon peels, and most states don't even allow any use of a lower pH than 3. just because they're going to be a little bit more aggressive. There's something called buffering agents that are just ingredients that are added into products to help make them less irritating. So a buffering agent may be added to some sort of acid peel, which could be just like regular baking soda, or vice versa. Something's a little bit too alkaline, they may add a little bit of like citric acid in it to make it a little bit more acidic, so it's not completely off the scale of where our natural skin pH is. Our cell renewal factor, or you may have heard it as our cell turnover rate, if maybe I've said it before, but this is the rate of cell mitosis and migration from the dermis to the top of the dermis. So it's basically our skin coming from the lower layer to the outside layer. And this slows down as we age, and that's why typically older clients can exfoliate a little bit more. They have a little bit more leathery skin, and babies have very soft, supple skin because their cell renewal factor or their cell turnover rate is a lot less than someone my age, someone a little bit older than me. You know what I mean? And keeping this cell mitosis going is going to be one of our goals for skin preservation. So chemical exfoliation can help with cell renewal factor or the cell mitosis going and keeping the skin a little bit more soft and supple. Our keratinized corneum layer is composed of approximately 15 to 20 layers, but it does vary in thickness in different body areas. So for example, that's why we can tolerate a lot more on our back doing a back treatment than we can on our face. Typically the layer of skin is going to be a little bit thicker. But generally, the cell renewal factor does help maintain a hydrolipic balance. And it's also good to know that overpeeling can be detrimental to the skin. You never want to be overpeeling or doing too much to the skin because that can cause an adverse reaction. So some factors that influence our cell renewal factor are going to include genetics, natural environment, and our medical history. So our lifestyle, any personal care, and what we typically do at home for exfoliation. Going into more depth about the light, medium, and deep peels, no pun intended, we have our superficial or light peels. And remember, these are the ones that we can do, so they're going to be administered by estheticians. They're only removing cells from the stratum corneum, so the most superficial layer of the skin. Generally, they include also enzymes. They can include glycolic acid at up to 30%, lactic acid up to 30%, and in some cases, we can use Gesner solutions at a low percentage and TCA peels up to 3 layers, but typically you're not going to use a very high strength of TCA or Gesner solutions. Chemical exfoliation can be used in place of the word peel, just so you know there is a difference between the medium and the deeper clinical peels, since the superficial peels typically aren't going to actually cause the skin to peel. And the medium and deeper peels are going to be administered by physicians. They penetrate deeper into the dermal layer. They can use resorcinol, phenol, which is a carboxylic acid, or baker's peel. Highly acidic peels that are, what's happening is there's going to be peeling down into the dermis, and they're not typically used. TCA peels are removing the epidermis down to the dermis, and glycolic acid peels up to 50% or more, and then also Gesner peels up to 4 to 10 layers. So for general effects of chemical exfoliation and peels, typically people would notice an improved texture of their skin, barrier function, and moisture retention. There will be an increased cell renewal factor, hydration and intercellular lipids, reduced fine lines, wrinkles, and surface pigmentation. Skin will look and feel more smooth and softer. There will be improved in skin conditions like acne, hyperpigmentation, clogged pores, and dry skin. And there is a potential stimulation of elastin in collagen production, so it can help kind of plump the skin for people that are aging. So some general precautions. Exfoliated skin needs to be protected from UV radiation to avoid hyperpigmentation and damage to the skin. So you have to have sunscreen or have to have your clients use sunscreen after. Peels can result in burns that may require medical attention and cause scars. You should follow the manufacturer's instructions for use of the peels. You should perform a patch test on the client before the treatment. Warn clients to avoid sun exposure, scrubs, rubbing, pulling dead skin, depilatories, waxing, benzoyl peroxide, and exfoliating or glycolic acid products for at least 24 to 48 hours before or after the treatment. I would recommend they don't really need to exfoliate typically after a week from their peel, but some people may have more tolerant skin and they can after the 2 days are up. For contraindications for chemical peels and chemical exfoliation, any recent cosmetic surgeries, laser resurfacing, chemical peels, or dermabrasion, recent injectables, fillers, or Botox, use of Retin-A or other medications that exfoliate or thin the skin, allergies or sensitivities to the products or ingredients in the product, pregnancy, active herpes simplex, so an active cold sore, hyperpigmentation tendencies, inflamed rosacea or acne, infectious diseases, open sores or suspicious lesions, sunburned or irritated skin, photosensitizing medications, and any other contraindicated drug or medication. So our first question is, what are the benefits of chemical exfoliation, and what are general contraindications for chemical exfoliation? Getting more into the types of chemical exfoliation and peels, we're going to start out with our enzyme peels. So what is an enzyme? Well, enzyme treatments are typically often referred to as an enzyme peel or enzyme mask. Enzymes are proteolytic in nature, so they're working to digest the keratin or the protein that's in the dead skin cells on the surface of the skin. So enzymes are basically kind of eating at the dead skin cells, and they come in different forms. There's either ready-to-use masks, or they come in a powder with a liquid activator. And ingredients, typically there's bromelain, peptin, and pancreatin. You can use enzymes about once every 1 or 2 weeks. Typically they're used in conjunction with clinical facials. You can use them to prepare for an advanced treatment. Typically they're not used prior to chemical peels, and you wouldn't really use them at the same time that you're doing a chemical peel. And some considerations for the treatment: you're going to consider the client's skin type, the sebaceous gland activity, so how dry are they or how oily they are, any skin conditions, the client's philosophy of sun exposure, the client's cosmetic and product use, and if the client is using Retin-A or other AHAs or acids or other acne drugs. That's another consideration you want to make. So some of the effects of an enzyme peel: they're going to be superficial, more temporary, and they're going to provide a refreshed, dewy complexion, but they're not going to be in depth and have a clinical change like a peel would or a chemical peel would. And if you can see the skin through the mask while it's processing, expect to initially see a very light erythema or pinkness to the skin, and some clients can experience minimal tingling. For contraindications and best practices for enzyme peels, you want to follow the manufacturer's instructions. Eyewear is always recommended to protect the client and the technician. Some areas of the face may process sooner than others, so you might have to perform a spot removal on those areas. And the best rule of thumb is for a newer esthetician to be prepared to remove the peel just prior to reaching the endpoint to ensure that you can complete neutralization and removal before the client becomes overprocessed. Moving on to AHA and BHA peels, we have alpha hydroxy acids, or AHAs, which are mild acids that come in different percentages and pH levels. They help dissolve the desmosomes to exfoliate the skin. So the desmosomes are the bonds basically between our skin cells that are being held together. So it's helping dissolve those to exfoliate off the skin cells. The AHAs penetrate the corneum through the inner cellular matrix, and they loosen the bonds between the cells, or the desmosomes. They stimulate a production of intercellular lipids. Most AHA peels don't yield any peeling or flaking, and they're going to include our glycolic acid, which is going to typically be the strongest and most commonly used, and it can penetrate more effectively due to the smaller molecule size. We also have our lactic acid, tartaric acid, malic acid, citric acid, and mandelic acid. So all of the peels that we have are AHA peels. We also have beta hydroxy acids, or BHAs. These are going to work under the same premises of AHAs. Typically, they're better suited to dissolve oil and are primarily used for oily skin and acne. And that is because beta hydroxy acids, or most commonly known as salicylic acid, is an acid that is oil soluble. So our alpha hydroxy acids are going to be water soluble. Our beta hydroxy acid most commonly is going to be salicylic acid that is oil soluble, and that's why it's working so well with oily skin and acne prone skin. So typically these are going to be a little bit stronger than AHA peels, and some people can encounter slight flaking or mild peeling. And it's good to know too, again, the salicylic acid has antiseptic and anti-inflammatory properties, so it's kind of another reason it's super beneficial for oily acne prone skin. So when would you use AHA peels? You want to consider the skin type, sebaceous gland activity, skin conditions, the client's philosophy of sun exposure, and their cosmetic use and product use, whether they're using Retin-A or other acids, any other AHAs or acne drugs. And it is preferred but not required that clients have a good home care routine to prepare their skin. Treatment plans are going to begin with a series of treatments to jumpstart their progress. So typically that means once every 2 weeks for so many weeks. And then maintenance is going to be more of a monthly peel. Some technicians' treatment plans work on a graduated peeling system, so you may use the lesser of the options and then work your way up to a higher strength peel. Stronger superficial peel treatment plans administered to clients whose skin is cleared for this level of peeling, and those who want to achieve faster results or have conditions that are better addressed with a stronger peel. And it's good to have photo documentation and before and after peels during the series, because it's going to be a good business practice for your personal records and to document the client's skin's progress. For BHA peels, it's going to be the same pre-treatment and home care guidelines as AHAs, but you may add in more products specifically targeting the clients with more oily skin or with more acne prone skin. And they're typically going to be primarily used on clients with oilier skin or with acne skin. And it's advisable to start with a lower strength and work up. You can still do a series according to the client's goals and outcomes, and maintenance would begin once the goals have been met to maintain the results. For contraindications and best practices of BHA peels, you generally want to follow the same course of action during and after both AHA and BHA peels, including before the service. You want to discuss potential issues and contraindications. You want to explain the procedures and the expected outcomes and realistic goals. You can do a diagnostic facial or more in-depth skin analysis before you schedule the peel treatment. So note on the client's intake form of their condition of the skin, and then you would choose the type of exfoliant based off of the condition of that client's skin and the desired results. You want to follow the manufacturer's instruction. Eyewear is always recommended to protect the client and the technician. You can apply occlusive barriers to the corner of the eyes, around the mouth, and around the nostril area. Be aware of the sun exposure during the summer and outdoors. So I know there's people that like to do more chemical peel treatments during the winter time, and then maybe more like microderm treatments during the summer months, just to kind of be on season. During the application, there will be a slight stinging and tingling, and you may want to provide clients with a fan to cool off the face during application. During the neutralization or the rinsing step, the peel may temporarily reactivate for a few seconds due to the water rehydrating the peel. With the BHA peel, there may be salicylic crystal residue present, and sometimes a wood lamp is used with the BHA application to view the accuracy and evenness of the peel application because it's more oil soluble again, so it would show up with the light would bounce back more orangish. Going into depth about our Gesner's and TCA peels. Our Gesner's peel is categorized as a stronger superficial peel and utilizes a Gesner's solution, which is a mixture of salicylic acid, resorcinol, lactic acid, and ethanol. And our TCA peels are a little bit stronger. Some states allow estheticians to use either the Gesner's or the TCA peels, but they're achieved at superficial levels by applying low percentages and fewer layers. They're going to work on the premise of protein coagulation, so there will be more flaking and more peeling from these, and they may not be neutralized, and sometimes they remain on the face for rinsing later. And home care regimen has to be followed with these. A lot of the times, if you're going to do any of this, you would have them take a home care kit of a very basic, very gentle face wash, face lotion, and SPF. When would you use a Gesner's and TCA peels? Typically, considerations for the treatment are going to be like any of the other peels: the skin type, the sebaceous gland activity, skin conditions, client's philosophy on their sun exposure, cosmetic use, product use, whether they're using Retin-A, other acids, or on acne drugs. Pre-treatment and home care guidelines are going to be the same as AHA's, but you might add products to address the aging, sun damage, and oily or acnetic skin. Gesner's peels are primarily used on clients with oilier skin and acne, but are also used to address sun damage. The Gesner's solution is usually applied in several layers, once every 3 or 4 to more weeks. TCA peels are primarily used for clients experiencing aging and sun damage, and they're usually applied in several layers, once every 3 to 4 or more weeks. And it's advisable to start with a lower strength and work up. A series can also be implemented according to the client's goals, and once their goals are achieved. And then our maintenance phase again is going to be once the goals have been met. You would just do once in a while. For contraindications and best practices, before the service, you want to discuss issues with the client and what they would like to be addressed and any contraindications. You would explain the procedures, expected outcomes, and realistic goals. And in a diagnostic facial or skin analysis before you would schedule the treatment, you should note on the client intake form the condition of their skin, and then choose the type of exfoliant based off of the condition of that client's skin and what they're wanting the results to be. You should follow the manufacturer's instructions. Eyewear is recommended to protect you and the client. Apply occlusive barriers to the corner of the eyes, mouth, and around the nostril area. Be aware of sun exposure during the summer and outdoors. And during the application process, there typically is going to be more stinging and tingling than experienced with an AHA or BHA. So you may want to provide a client with a fan to cool their face during the application. Immediately after the application, clients will probably have a mild erythema, pink or reddening of the skin, and there may be areas of frosting on the skin or an overall light frost depending on the depth of the peel due to protein coagulation. So it's like their face turns a little white. Over the next few days, the skin will become bronzed and tighten. The flaking and peeling will begin over the areas of the face that frosted the most, and then all over the other areas will experience the same. And it's good to warn clients to not pick or peel the loose skin. And once the peel process has completed, the skin has normalized, clients can return to their normal skincare products. So there's something called a designer peel, and these are just to yield more targeted results. So there's going to be additional ingredients that may be added to formulas, including pigment lighteners, acne ingredients, and moisturizers or hydrators. So it's just designed peels, basically. Moving on to microdermabrasion. So microdermabrasion is machine-based exfoliation treatment that uses a crystal spray or diamond tips to gently polish dead skin cells from the skin's surface. In a crystal microdermabrasion, the procedure has a spraying high-grade microcrystals that are composed of cordium powder, aluminum oxide, or similar abrasive material across the skin's surface through the handpiece, and then they are simultaneously vacuumed off and disposed of according to the biohazard cleanup process recommended by the manufacturer. They're considered more messy, and if not all of the crystals are removed, it requires additional cleanup. And manual microdermabrasion, the crystals are used without the machine, so they're a little bit more gentle on the skin. So that would be in a product. And in our crystal-free microdermabrasion, that is going to be the handpiece that has the diamond tip applicator that also gently polishes away the upper layers of the skin without the use of crystals. So this is the machine that we're using at school, and it's gained popularity. It yields the same results without having the cleanup or the expense of the crystal machine. There is something called hydrodermabrasions or wet microdermabrasion. I would say the Hydrofacial is the most notorious hydrodermabrasion machine and most popular, but this is a non-invasive and non-irritating procedure. It combines mechanical and liquid exfoliation with serum penetration and hydration, and it can be combined with LED or microcurrent for anti-aging benefits. It provides reliable exfoliation without drying after effects of microdermabrasion or harshness of chemical peels, with the added benefit of extended hydration. For timing, you could do a quick 30-minute service with just the hydrodermabrasion, or you could also incorporate it as a part of a facial or as a part of an advanced treatment. For microdermabrasion technique, some contributing factors for a successful treatment is proper use of the handpiece, a rate of crystal flow if you're using crystal microdermabrasion, and having the vacuum setting on appropriately. It's imperative not to damage the skin when stretching for the treatment or the action zone. The number of passes is going to be determined by the client's skin type and condition, and the presence of erythema or the ruddiness, and the tolerance of the skin. Some passes are going to consist of horizontal, vertical, and then diagonal applications, and cross-hatching method can also be used to complete the treatment quicker if you know your client is a little bit more tolerant. and training and certification are mandatory for microdermabrasion. So when would you use microdermabrasion? Microdermabrasion is best suited for clients who can't tolerate acids, and it's also an effective tool for surface exfoliation. And the effects of microdermabrasion, it's used to diminish sun damage, pigmentation, open and closed comedones, fine lines and wrinkles, enlarged pores, or coarsely textured skin, which is my particular favorite thing to use it for. And in addition to typical exfoliation benefits, the vacuum machine stimulates cell metabolism and blood flow. The contraindications for microdermabrasion: any cosmetic surgeries, laser resurfacing, chemical peels, and dermabrasion that is recent injectables, fillers, or Botox, use of Retin-A or other medications that exfoliate or thin the skin, allergies or sensitivities to products or ingredients, pregnancy, which some healthcare providers may clear the client for service. I would just be cautious with pregnant clients, again, with their hormones in whack. Typically, they may be more sensitive than usual. Active herpes simplex, infectious diseases, open sores or suspicious lesions should be obviously avoided. Hyperpigmentation tendencies, inflamed rosacea, acne, fragile skin, cuperous skin, sunburn, or irritated skin. And then also clients that have are on photosensitizing medications or any other contraindicated drugs or medications. So precautions: the clients should avoid sun exposure, excessive sweating, scrubs, rubbing, depilatories, waxing, benzoyl peroxide, and exfoliating or glycolic acid products for at least 24 to 48 hours before and after. Do not use aggressively if the client is uncomfortable. The endpoint of the procedure is going to be when the skin shows erythema or redness. If you have a crystal microdermabrasion machine, you should try your best to avoid getting the crystals in the client's mouth, nose, or ears. And improper use can cause hypopigmentation, hyperpigmentation, and sensitivities. For best practices and safety considerations for microdermabrasion, you should discuss issues, contraindications, procedures, and the outcome and realistic goals with your client. In a diagnostic facial or skin analysis, note on the client intake form the condition of their skin. Follow the manufacturer's instruction. Eyewear is recommended, and a mask for the technician is also required, specifically with the crystal microdermabrasion. The microdermabrasion should be used with extreme caution during outdoor exposure, and it's preferred but not required that the client begin a home care regimen prior to doing a treatment like microdermabrasion. And the treatment plans begin with a series of treatments to jumpstart the progress. So like once every 2 weeks for so many weeks. And then maintenance is going to be more of a monthly treatment. And photo documentation and before and after treatments will be beneficial for you and any potential client that may want to see that. And it's important to schedule treatments that is based off of the client's skin's tolerance to the procedure. For the safety of and maintenance of microdermabrasion machines, it's important to note that the daily care and proper use is to prevent any unnecessary machine repairs. Dermabrasion machines typically consist of internal motors, hoses, filters, and handpieces that have to be completely dried to work properly. For crystal microdermabrasion machines, it's recommended to only use the crystals recommended by the manufacturer, and avoid breathing the crystals or getting them into the eyes or the nose. Carefully clean up the crystals while wearing rubber gloves and a mask. And the treatment room and linens also need to be cleaned and checked for any crystal residue and contamination. Question number 2 is, what benefits does microdermabrasion have on the skin? Moving on to laser technology. Laser is an acronym for light amplification, stimulation, emission of radiation. It's a medical device that uses intense pulses of electromagnetic radiation and a single wavelength for hair removal and skin treatments. It's designed to focus all of the light power with the same color, traveling to a specific depth in one direction. The wavelength of the laser and its use is determined by the medium used, so if it's a solid, liquid, or gas, or semiconductor. Lasers are rated Class 4 medical devices? Yes, Class 4 medical devices by the FDA, and not all states allow estheticians to use them. So when you would use or the effects of the laser technology, all lasers and light therapy methods are using selective photothermolysis, which the thermolysis is meaning a heating effect. It's useful for skin rejuvenation, heating, and damaging dermal tissues to stimulate fibroblast. So that means it is going to be useful for skin resurfacing. So the lasers that are directed are going to, in quotation marks, burn off the skin without touching the lower dermis. And in different treatments, it can also stimulate collagen production, reduce spider veins, reduce hair growth, and peel the skin as well. It is useful for treating some skin conditions. So some lasers can target specific substances like melanin, dark hair, blood vessels, skin growth, and pigmentation. And those will absorb the energy, which causes the cells to heat up and be destroyed, which then leaves normal skins intact, or normal skin cells intact. It's commonly used for non-invasive procedures, and there's a photodynamic therapy, which is used primarily to treat actinic keratosis. And lasers combined with radio frequencies are considered to be even more effective by stimulating collagen production and producing a firming effect. And it's used on skin healing, tightening, hair removal, and for cellulite reduction. So light therapy is super neat. It is the application of light rays to the skin. It can help treat wrinkles, capillaries, pigmentation, and unwanted hair. There's different types of devices. There's lasers, intense pulse light or IPL, and light emitting diodes or LED technologies. The power and effectiveness depend on the wavelength, the heat, and the penetration power. There is a range of wavelengths used in light therapy. There are visible, infrared, and far infrared. Infrared light is neat. It's been around for some years to treat physical conditions and pain, and it can also promote healing. It's used in salons for hair treatments. It can be used in spas and saunas for relaxation and warming the muscles, detoxifying the body, and reducing pain. It says detoxifying the body, but that's just because as you get warmer, you're going to sweat more and perspirate and detoxify that way. Personally, I have used infrared light in saunas, and I can tell a big difference. I think it works wonders. I can feel my muscles kind of just completely loosen when I'm in there, and I find it to be a little bit more therapeutic. So I think it's fabulous. There's something also called near infrared light, which is useful for signs of aging, wound healing, and increasing circulation. This has the longest wavelength and can penetrate the skin the deepest. Therapeutic lamps are also used in light therapy. The color of the therapy is going to use different colors for various psychological effects, and red is going to be stimulating and green would be more calming. So that is a therapeutic lamp. Intense pulse light, or IPL, uses pulses of multiple wavelengths. This is used to reduce pigmentation, remove surface capillaries, and rejuvenate the skin. Photorejuvenation utilizes the light therapy to enhance the skin, so it is not causing harm to the skin, and it treats extrinsic and intrinsic signs of aging. Some of the effects of IPL include treating fine lines and wrinkles, skin texture changes including the roughness and coarseness, telangiectasia or the small spider veins, the red spider veins, pigmented lesions or dyschromia, poikiloderma of civetite, I don't know how to say it, I'm sorry, rosacea symptoms, erythema or redness, flushing, and also papules. Light emitting diodes or LEDs can be used to help reduce acne, increase skin circulation, and improve the collagen content in the skin. For the photomodulation, there is a non-thermal, non-ablative cellular stimulation, which is triggering a photobiomechanical response. So that just means that there's no heat involved, it's not destroying any layer of the skin, and there is a mechanical response in the skin that is happening from it. So that's what that basically means. The LED is used for skin rejuvenation, so the LED individual wavelengths are used at low intensity and use visible light and also infrared or invisible light. It works by releasing light onto the skin to stimulate specific responses at precise depths of the skin, depending on the color or the nanometers of the light. And the LED color of the light is seeking color into the skin, which is known as chromophore. So some of the effects of LED light, we have red light, which is going to be around 640 to 660 nanometers, and it increases cellular processes, boosts collagen and elastin production, stimulates wound healing. I also want to add in that red light probably has the most research or the most extensive research done on it, just because it used to be studied for the wound healing properties, and then that's when they found that it's kind of good for the skin, that it helps boost collagen and elastin production. So that's why red light has probably the most research backed behind it, and all of the other lights are probably being more researched now after we've found out that red light actually does something. So I would say red light has the most research on it, and then I think blue light is probably kind of second, that it also has a lot more research done on it, but red light is definitely the top leading, most studied. And then yellow light also begins at 575 to 595 nanometers, and this is thought to reduce inflammation, improves lymphatic flow, detoxifies, and increases circulation. Green light is between 500 and 525 nanometers. It can lessen hyperpigmentation, reduce redness, and calms and soothes. Blue light is 410 to 450 nanometers. This is going to improve acne, reduce bacteria, and it can be used with medications for precancerous lesions as well. So for contraindications for LED or the light emitting diodes, pregnancy, open or unidentified skin lesions, seizure disorders, autoimmune disorders, or clients taking photosensitizing medications. And for our best practices for LED, you want to make certain that you have viewed the client consultation form for any contraindications. Light therapy should not be performed on anyone who has light sensitivities, has phototoxic reactions, or is taking antibiotics, has cancer or epilepsy, is pregnant, or is under a physician's care. They can be used in facials for approximately 15 minutes. Protective eyewear is used to protect both the technician and the client's eyes, and the thyroid area should also be covered since it can also be stimulated. For safety and maintenance for LED machines, machines should be maintained in accordance to manufacturer's instructions, and machines and protective eyewear should be disinfected after each use. Question number 3 is, what is light therapy and what is it used for? Moving on, we're going to discuss microcurrent treatments. So, microcurrent treatments or wave therapy mimic the way the brain relays messages to the muscles. It's growing uses of microampere electrical neuromuscular stimulation, and it includes healing muscles, wounds, controlling pain, and even fusing bones together. In aesthetics, it's used to relax muscle, strengthen and tone the muscles by stimulating motor nerves and contraction of the muscles. The standard technique has two handheld probes placed on the facial muscle groups, and an ampule may be applied under the conducting gel. Treatments are given typically once a week for at least 10 sessions, and then maintenance would be given once every about 4 weeks. And when you would use microcurrent, as you age, electrical impulses in our body slow down, causing the skin to sag. So it's thought in aiding in healing and repairing of the tissues and to influence the metabolism. It works gently by helping speeding up the natural regenerative process of the body, and it can be combined with ultrasound technology for penetration and exfoliation. It can also be combined with light therapy to increase the effectiveness. With the effects of microcurrent in aesthetics, it's primarily used to tone and stimulate the facial muscles, which result in firmer and healthier skin. It can also firm muscles and boost cellular activity. It improves blood and lymph circulation. It can also assist with product absorption. The contraindications for microcurrent: any open wounds, muscular diseases, advanced diabetes, pacemakers, epilepsy, cancer, pregnancy, hemophilia, phlebitis, and thrombosis, and anyone currently under a healthcare provider's care for a condition that could be contraindicated. And its typical recommended use of microcurrent treatments with injectables is to wait about 2 weeks after the injection procedure. For the best practices and safety considerations, it's important to review the muscle location, the origin and insertion, and follow the instructions and recommendations provided by the manufacturer. The safety and maintenance of microcurrent should be maintained in accordance from the manufacturer's instructions, and machines and protective eyewear should be disinfected after each use. Moving on to ultrasound. So we have ultrasound or ultrasonic, which this is a ultrasonic skin scrubber or skin scrubber. This is referring to a frequency that is above the range of sound that is audible to the human ear. So ultrasound equipment uses non-invasive sound waves. Ultrasonic equipment is based on a high-frequency mechanical oscillation produced by a metal spatula-like tool, which would be our skin scrubber. When you would use the ultrasound technology or the ultrasonic spatula, it's used for product penetration and for cellulite reduction. The vibrations that are created through a water medium help cleanse and exfoliate the skin. Ultrasound penetrates deeply and it stimulates the tissue, increasing the blood flow and promotes oxygenation. Cellulite is affected through heat manipulation performed with the device, and heat damage stimulates the collagen production as well. Sonophoresis is the process where the device sends waves through the skin to assist in product penetration. Some equipment is rated as an FDA Class II device and may not be within an esthetician's scope of practice outside of a medical facility. Handheld devices for consumers' personal use at home are milder and should be used in moderation, and it's also a viable choice for clients with sensitive skin or rosacea. My preferred use of the ultrasound or the ultrasonic spatula is to do extractions, or kind of like extractions, is to use it to take out any backed up debris or any blackheads and excess of oil. For contraindications and precautions for ultrasound technology, any open or unidentified skin lesions, heart conditions, pacemakers, or electrical implants, epilepsy, pregnancy, advanced diabetes, cancerous lesions, and anyone currently under a doctor's care for a condition that could be contraindicated. For best practices and safety considerations, avoid excessive heat buildup and unstable captivation by maintaining a constant movement of the handpiece on moist skin, and caution should be used with fragile skin and in thin, delicate areas. For safety and maintenance for ultrasound machines, the ultrasound machine should be maintained in accordance of the manufacturer's instructions, and it should be disinfected after each use. So moving on to microneedling and nanoinfusion, it should be noted that not all states allow estheticians to perform microneedling or derma rolling and categorize it as a medical procedure, which requires a physician's supervision, which is the case for estheticians in Illinois. So microneedling and derma rolling are super neat. It's a form of collagen induction therapy, or CIT. It causes tiny needle pricks across the skin from the rollers or an electric handpiece that induces collagen formation during the wound healing process. Nanoinfusion is an alternative, and this can be used by estheticians in states that don't allow microneedling in an esthetician scope of practice. The use of microneedling handpiece, but it has needle-free nanotips that do not penetrate the dermis and allows for safe treatment with no downtime. It's a popular alternative since it is non-invasive. It's using a single-use sterile cartridge made of microscopic or surgical steel pyramid-like modules, and it creates thousands of microchannels on top of the skin, while the vibratory action of the handpiece assists in penetrating any topical products. So question number 4 is, what is nanoinfusion? Moving on to spa body treatments. Body treatments have a therapeutic effect and treat the skin of the whole body. It's good to be mindful of contraindications and allergies to ingredients. Body wraps are treatments where product is applied on the body and then covered or wrapped. It's used for various reasons and can remineralize, hydrate, stimulate, detoxify, or promote relaxation. All products used will determine the effects and results. After the client is wrapped, they are cocooned in a blanket or a sheet. And there are something called Inchloss wraps, and those are a little bit more controversial. Body scrubs are used with friction to exfoliate and hydrate, increase circulation, and nourish the skin using a combination of ingredients combined with oil or lotion. They can also be called polishes or glows, and they prepare the skin for additional products or treatments after. Body masks remineralize and detoxify the body, primarily using clay, mud, or seaweed mixtures. Certain masks can help treat cellulite. Similar to wraps, clients are usually wrapped after the mask is applied, and the ingredients and procedures used will determine whether the process is a mask or a wrap. Hydrotherapy uses water in its 3 forms, so it can be either ice, steam, or liquid. So our steamer is a form of hydrotherapy technically. Balneotherapy is treatment of physical ailments using therapeutic water baths. So mineral, mud, or fango, Dead Sea salt, seaweed, enzymes, and peat are used in the baths for balneotherapy. Stone massage is using hot stones or cold stones in massage or other treatments. Foot reflexology is the technique of applying pressure to the feet based on a system of zones and areas on the feet that are directly corresponding to the anatomy of the full body. It can cause relaxation, increase circulation, and balance, but be aware of your scope of practice and licensing regulations, since estheticians are not usually trained in reflexology. You could be trained in reflexology if you were a massage therapist, though. Ayurvedic are concepts that are based on 3 doshas, or mind and body types. The treatments include Shirodhara massage and facials using Indian concepts and ingredients suited for the three mind and body types. So Pitta, Kapha, and Vata. So I don't know what any of that means, I'll be honest with you. Sunless tanning is product application, which is a service offered as an alternative to tanning. So this would be like our spray tanning. Endermology is a treatment for cellulite that helps stimulate the reduction of adipose tissue by a vacuum massage or cupping massage. Reiki is a Japanese technique for stress reduction and relaxation that also promotes healing based on our unseen life force energy. So it's an advanced massage modality that kind of works with energy work. So Reiki is kind of just like energy work. And other energy practices include energy balancing and chakras. So some treatments used to address cellulite. Cellulite appears to be dimpled or bumpy skin that's caused primarily by female hormones and genetics, and it consists of fat cells. It's more visible when dermal fat cells are closer to the surface of the skin, and it can occur from damage to the skin. For reducing and treating cellulite, to repair cells and connective tissues have to be strengthened and hydrated through nutrients and water intake. Increasing blood flow, stimulating collagen and elastin, attracting water to cells, and repairing cells' membranes are recommended to reduce the cellulite. It's important to know that many treatments only temporarily reduce cellulite, like detox diets, liposuction, vacuum devices, manual lymphatic drainage, mesotherapy, dermafillers, lasers, chemical peels, and microdermabrasion. And professional cellulite treatments must be performed consistently in continuous sessions. A common spa treatment consists of exfoliation, a detoxifying mask and wrap, and then ending with a cellulite treatment cream. The lassotherapy is another popular treatment that uses seawater to help treat cellulite. Manual lymphatic drainage, or MLD, stimulates lymph fluid to flow through the lymphatic vessels. When you would use manual lymphatic drainage and the effects of this modality, it helps cleanse and detoxify the body because it aids in lymph flow. Congestion, water, and waste in the lymphatic vessels create edema or swelling in the tissue. Moving the fluid out of the body with light massage movements can help decrease the swelling from the excessive fluid. It's a great addition to a facial and other treatments as long as you are certified, and it's both used in before and after surgery since it expedites healing and enhances any cell metabolism. You can get some advanced training courses, but some states do require advanced license, so you may need a massage license to do manual lymphatic drainage. Question number 5 is to explain the benefits of manual lymphatic drainage. Medical aesthetics integrates surgical and non-surgical procedures with aesthetics treatments. An esthetician's role in medical aesthetics would be to probably perform services like peels, microdermabrasion, and light therapy. Some can assist with medical procedures and monitor patient recovery. Their role can be shaped to fit the facility's needs. Clinical estheticians are well-trained, experienced, and in some cases certified. Most clinical procedures must be done in a medical office under the healthcare provider's supervision, and estheticians are qualified to perform certain procedures, but they should be familiar with them to answer any questions from clients. Home care products will typically be recommended by the esthetician to help patients heal faster and to help maintain their skin's health. And the most popular medical spa services are going to be chemical peels, microdermabrasion, Botox, fillers, laser hair removal, and light therapy or photo rejuvenation. So estheticians can assist in preoperative and postoperative care. So this might include doing some prepping peels before they go under surgery, or post-op care, facials so they can help recover faster. So for preoperative care, it's going to focus more on prepping the skin for the procedure by increasing the skin's metabolism and reducing cellular debris on the skin's surface. And for post-op care, the skin care is going to be used for rapid wound healing and the avoidance of infection. Massage, hydration, protection, and camouflage makeup even are often a part of the post-op care too. And microdermabrasion and chemical peels, so glycolic treatments can also be performed to precondition the skin before laser resurfacing or surgery. So documentation, they would probably have you fill out SOAP notes. So the patient's chart would be a record of what the patient conveys, so the subjective part, what the esthetician observed, so objective part, the assessment and analysis in the assessment part, and then the plan of action for the treatment. In other clinical procedures, there are laser and medical centers that offer hair reduction, spider vein removal, non-ablative wrinkle treatments, and other types of laser procedures. Non-ablative wrinkle treatments are going to include our IPL, and that's going to be used to bypass the epidermis and stimulate collagen in the dermis. And estheticians can assist healthcare providers if they're properly trained and certified. Injectable fillers are used in non-surgical procedures to fill in or plump areas of the skin. It's FDA-approved fillers that are going to be non-toxic, durable, and biocompatible, and easy to use, which is all necessary for a safe filler. And they've become the fastest growing product in the medical spa industry. Botox is a neuromuscular blocking serum that paralyzes the nerve cells on a muscle, so it stops the muscles from moving. It relaxes the tissues and can help diminish lines. And the gabula is the most common site probably for Botox injections, which is right between the eyebrows. Dermafillers are used to fill in lines, wrinkles, and other facial imperfections, and they're obtained from a variety of sources. So many of them can be combined substances and materials. Collagen can be derived from either human or animal sources, and synthetic sources are going to be more silicone or hyaluronic acid. And new products come out on the market regularly. So surgical procedures, there is reconstructive surgery, which is going to restore a bodily function, and it is necessary for accident survivors and those with a congenital disfigurement or other disease. And a cosmetic surgery is also known as an aesthetic surgery because it is an elective surgery that is used to improve and alter the appearance of the skin or the appearance of the body. A retirectomy is a facelift. This removes excessive fat around the jawline, and it tightens loose atrophic muscles and removes sagging skin. A forehead lift or a brow lift can also be performed separately or in combination with an eye lift. A blepharoplasty or an eye lift removes the fat and skin from the upper and lower eyelids, and if eyelids impede a patient's ability to see, it is a medical condition, so then it would be considered a reconstructive surgery. A transconjunctival blepharoplasty is performed inside the lower eyelid to remove bulging fat pads. So if someone naturally has more fat under their eyes and it's not fluid, you wouldn't be able to treat that with a lymphatic drainage. They would have to have the transconjunctival blepharoplasty. Some other cosmetic surgical procedures include rhinoplasty, which is a nose procedure, or laser resurfacing, which is used to smooth wrinkles or lighten acne scars. Dermabrasion, which is very much different from microdermabrasion. Dermabrasion is very invasive. It is a strong exfoliation method that uses a mechanical brush to physically remove tissue down to the tissue. It removes the outside layer of the skin down to the dermis, and it's primarily used on scars. Trichoroleic acid, or TCA peels, are deep peels that are used to address sun damage and wrinkles. And pheno peels are the strongest peels and can be toxic, but they are still used and are less expensive and require a long recovery period. Some body procedures: we have sclerotherapy, which minimizes varicose veins and other varicosities by injecting chemical agents into the affected area, and lasers are a secondary method of vein therapy. A mammoplasty is a breast surgery that enlarges breasts or reconstructs them. It often is referred to as a breast augmentation or implants, and a breast reduction can help reduce or reposition the breast. Liposuction is a procedure that surgically removes pockets of fat. An abdominoplasty removes excessive fat deposits and loose skin from the abdomen to tuck and tighten that area. So to conclude, the clinical esthetician requires compassion and patience, because you will be working with people who are in pain, who are experiencing physical trauma. The opportunities for advanced training are limitless, and there are many services that you can specialize in. And as the industry continues to grow, it's good to keep up with modern technology and any changes that come with it. So to recap on our learning objectives, we explained advanced skincare topics and treatments for licensed trained estheticians, described chemical exfoliation and peels, identified how to safely and effectively use chemical exfoliation and peels, discussed the benefits of microdermabrasion by type of device, explained the benefits of laser technology, explained the benefits and types of light therapy, discussed microcurrent treatments, discussed ultrasound, discussed microneedling and nanoinfusion, described body treatments, discussed common treatments used to address cellulite, explained the benefits of manual lymphatic drainage, and described the field of medical aesthetics. And that is going to conclude our Chapter 13, Advanced Topics and Treatments. Until next time, bye!